Soweto, the country's biggest township, has the most COVID-19 deaths in the province and also has the most active cases in the province. Data released by the Gauteng Provincial Coronavirus Command Council on Friday shows that there have been 60 people who have been killed by COVID-19 in Soweto alone. To understand why Soweto is taking the lead and the ongoing interventions, we've asked the President of the Health Profession Council, Dr. Kgosi Letlape, to join us for some insights. He is on Skype. Dr. Letlape, very good evening to you. Thanks for joining us. Welcome to the Globe.
Viewers?
Perhaps the big question, Dr. Letlape, is why is Soweto really taking the lead?
Well, I think it's common experience that where you have dense population and people are crowded, that's where the virus will be transmitted much more effectively. As we know, Soweto is not a big area, but it has a dense population. So the opportunities to be in crowds is quite high, whether you're in the streets or you're in the shops or you're in the taxi ranks. And even in the household, the numbers are quite high. And that is why we can expect community spread to be quite profound in a situation like that.
So could that have to do with the scale and the nature of testing and contact tracing? I mean, do you get a sense that authorities are only focusing on the hot spots where the results are likely to come back negative or rather positive and giving rise to the high numbers in Gauteng?
I think what we should focus on is the social behaviors, because prevention is not really dependent on testing. Testing just gives us the sense of the numbers that we are dealing with. But it's the social behaviors. So what is concerning is if you walk around Soweto, I was in Soweto today, you see people walking around without masks, you see people walking around without wearing masks properly, you see people crowded in yards without social distancing. So that's a recipe for disaster. And I think it's time that we as society understand that the virus is not going to be kept by testing. Testing just gives us a picture of how are we behaving and are we slowing down the spread of the virus. But it's our behaviors that are critical in fighting this pandemic.
Should we narrow our analysis into the cases slipping through the cracks? I mean, if the other provinces could do their utmost best in terms of contact tracing and testing, would the numbers likely rise exponentially, taking into cognizance some of the cases which still go undiagnosed?
Well, you know, we have people that test positive. They've been traced, they've been tested, and they say they're going to isolate. Then they go around, they mingle without masks and without declaring. So the biggest problem we have is our behavior as members of society. Some people, when they are being traced, they don't come forward. There are many challenges. But I think what we should begin to do as citizens is to take responsibility for our behavior. Because if we do our best to protect others, that's what's going to slow the numbers. And, you know, I'm not saying that there's no responsibility from authorities to making tests available for quicker turnaround times, for proper tracing. Those things are important. But it's the social behavior and responsibility of citizens that's going to get us out of this problem.
Now, new research emerged, that coronavirus can actually spread through tiny droplets that are suspended or rather that are floating in the air. So should this piece of research change the way people are taking, precautions? I mean, you've repeatedly said that behavior is the most important key.
Well, the point is, what has been found is that there are micro droplets which are airborne that have been found to be around for about 2 hours. But it is being further investigated in terms of how it impacts on spread. So this is basically just open disclosure. But the major form of spread is still as we have been expressing. But more importantly, even if you have airborne infections, the measures that we would take would still be the same. Social distancing, masking, hygiene, hand washing, cleaning of surfaces. It just will urge us to be more vigilant. But it's not like if it's airborne, there's a new strategy that comes up front. It just means the ease of spread might even be more than we've contemplated before. But the measures that we take would still be pretty much the same.
Well, in as much as this new information that is emerging, Dr. Letlape, you speak of encouraging us to be even more vigilant, but then will this perhaps not cause more confusion leading to what is now known as pandemic fatigue?
No, we can't be fatigued because the virus is not going to be fatigued. The virus will only be fatigued by us not being fatigued and continuing to do the right thing. But the important thing about once you have suspicions of being airborne, in other countries, people are being encouraged to wear masks even at the home. Remember that what we see now and what is going to increase going forward is that family members are going to be infected by other family members that have been outside. So if you've been outside and there's a chance of contamination and you've been in high-risk areas, you should behave appropriately when you get home to protect your family, where you should sanitize before you get in, change the clothes that you are wearing, take a shower before you have contact with family. And even inside, if you are a health worker, for example, you should still physical distance. If you look at what was happening in the US, when the health workers were coming home, they were actually isolating from the family. So we just need to understand that we now need to take personal responsibility and be more vigilant in terms of protecting others from ourselves and ensuring that we do our best. That's how we're going to overcome.
Well, for purposes of becoming even more vigilant in terms of protecting ourselves from this coronavirus, we know now that a droplet through sneezing or coughing can travel to a distance of about 1 meter, which forms the basis of the social distancing guidelines. But then what boggles the mind is how long can a droplet travel which is suspended or floating in the air?
Remember that if you are in open air, and there's airflow, there'll be great dispersion of whatever comes up. The greatest problem is if you are in an enclosed environment, like if you are in a church, or you are in a shopping mall, or you are in a shop, or you are in a household, and there's many of you. That is the greatest problem. Even inside transport, in vehicles, in taxis, in cars, open the windows so that there's airflow. If you have air that circulates in a small space, that's where science has proven that the chances of infection are quite high. If you have air conditioners that just recirculate the air in a room and is not extracting air and bringing in new air, you are at higher risk of spreading the virus inside the room and people can inhale it. And the important thing is that even if you are indoors, physical distance and wearing of masks reduces the risk of being infected. The greatest time when people get infected is when we're socializing, within social distancing, and we're not wearing masks. The chances of transmission are quite high in those circumstances. So we should be vigilant even when we are with people that we live with every day.
And what is
we work with every day.
What is equally more concerning, Dr. Letlape, is that, testing will be negative when you are in the window period, and the window period is aptly described as between 1 and 14 days if you display no symptoms whatsoever. But then going for a test in the window period is absolutely no value because a negative result cannot be trusted, can it?
But that is why, because of the scarcity of tests, the testing strategy is evolving, where it will be done in accordance with risk categories. If you are a close contact for a prolonged period with a person that is positive, you are at high risk. If you are an inpatient, if you are a healthcare worker in COVID environment, so the degree of exposure becomes important. If you are a contact of a contact, just isolate, testing will not help you. And that's why we're triaging to the point where if you are a contact, you social distance, don't test in the first 7 days, unless if you become symptomatic, then test. As the minister has adequately explained, if I'm exposed and I isolate and I self-quarantine for 14 days and I don't have symptoms, that's all that is needed. Because remember, even if you are positive and asymptomatic, the regime becomes the same. You still have to self-isolate and be symptom-free for 14 days before you can come out. Remember, in the beginning, we used to say if you've tested positive, at the end of 14 days, we will test you so that you test negative. Because tests are not plentiful. We are now not routinely testing people that have been asymptomatic that have tested positive. You are presumed to be clear of the virus if you've been asymptomatic for more than 14 days.
So how many times should we test then, Dr. Letlape? I mean, if I'm in contact with a coronavirus positive person today and I go for testing tomorrow and then I wait for the so-called window period for 14 days, should I go back to testing again? Do you think that South Africans, can actually do that, going testing multiple times?
Just remember, if you have been in contact with a person that is positive and you spend 20 minutes, half an hour with them, you are at high risk of getting infected. What you can do is to self-isolate for 14 days. And if you become symptomatic, then in that period, then test. Then from the period that you are symptomatic, having tested, you then restart counting the 14 days to the period to be cleared. So it is not necessary, because if you are exposed now and the incubation period is 1 to 14 days, immediate testing is not advised. Isolate immediate. Test if you become symptomatic.
Well, realistically speaking, given the nature of South Africa's economic standing, do you see South Africans, voluntarily self-isolating, given the fact that, there's no other alternative means of a livelihood?
You see, we can't have it both ways. We can't be having this double speak about livelihoods when you want to have your livelihood, infect the rest of your family, and have 3 members that you now have to bury. How are you preserving your livelihood? This is time to understand that we are picking. And people should forget this issue about a competition with livelihoods. Let's preserve lives. Let's stay alive so that you have an opportunity in 3 weeks' time or in 6 weeks' time to be looking for a job or to be rekindling your livelihood, instead of in 2 weeks' time being buried. Those are the choices that we have to make. And we have to stop making it a competition between livelihoods. The virus does not discriminate. And we are now at a point where the numbers are rising. We in Gauteng have the smallest landmass of any province with the highest population density. That means transmission will be extremely high under those conditions. So we have to be more careful. My advice to people is voluntarily go back to level 5 personal behavior. We should not wait to be told what to do after all the information that we have been given. We now seeing people dying suddenly. We now seeing people, ill for 3 days, gone. The virus is with us. Let's not make it a competition about livelihood. I'm vulnerable. I'm over 60. I have a comorbidity. I'm in a specialty that's one of the top 3 disciplines in medicine that's been infected: anesthesiologist, intensivist, and ophthalmologist. And I have voluntarily not been going to work. It's not that it's not economically painful, but I'd rather live than be brave when I'm at high risk. So we need to make those decisions ourselves. and we will overcome. But to overcome, we need to be alive when we come off the peak and when we go past this first phase.
Dr. Letlape, just before I let you go, I mean, you are seemingly shooting down on concerns or suggestions of a livelihood over, protecting ourselves about coronavirus. You also mentioned quite remarkably that we should be living level 5 behavior. So what do you make then of suggestions of us going back to level 5?
I think we need to rise as South Africans to taking personal responsibility, loving ourselves, loving our neighbors, and taking ourselves seriously. We have been given enough knowledge about COVID in the last 107 days. So all of us know what the appropriate behavior is. We should not be going out unnecessarily. We should only be going out when it is necessary at this point in time. We should not be waiting to be told by the National Coronavirus Command Council of what the right thing to do is. We shouldn't behave like there's nothing between our ears. And we should make personal choices, personal decisions, and take personal responsibility for ourselves. The state will continue to support us. But at the end, the virus is spread person to person. The biggest challenge we face now is community spread, not hospital spread, not government spread. And it's us, the community, that have to stand up, take responsibility, take action, and curb the spread of the virus.
Dr. Letlape, great chatting to you. Thank you so much for your update. We appreciate your analysis of this issue.
Thank you very much, and thank you for giving me the opportunity to appeal to fellow South Africans that it's in our hands. Let's keep washing them. Let's wear those masks without fail. Even use them inside the household if appropriate. If you have family members that have an urgent reason to visit, you don't know where they are, behave like you behave in public.
Yeah.
Protect each other. Wear masks, observe and hygiene, physical distancing, no hugging, please.
It certainly is in our hands. Thank you so much again, Dr. Letlape. That was President of the Health Professions Council, Dr. Kgosi Letlape, joining us via Skype. Let's take a